Have you ever thought about being in nursing? Well, here's a day in the life of a nursing major.
The CNA program, there's nothing they have to do except sign up and do it. We have another program called the Associate Degree Program, the Associate of Applied Science, and it's a bridge program for those that are paramedics and LPNs already. And then there's a couple of other courses they take and then they apply, and they're done in 2 semesters with that one. We also have the pre-licensure BSN. There's a whole list of prereqs that you have to take, and then they apply. With both of those, because they're face-to-face and they're a competitive situation, they take what we call the HESI A2, which is a test that sees that they have retained the knowledge that they got from their prereq classes or their previous coursework. English, math, science. And then we have an RN to BSN program, which is for those that you can be a nurse as an associate degree, a diploma, or a baccalaureate. And so for those that are associate and diploma, we have what we call RN to BSN. So they're already working nurses. They want to get their BSN for whatever reason. And right now, most hospitals are looking to hire BSNs. And so that program is a totally online program. They need to do some application. We just make sure that they've got their licensure and that they've finished a pathophysiology course and some other things. And then our newest program is our MSN program, and that's where they have to have a bachelor's degree from a regionally accredited as well as a nationally accredited program.
The thing that I like most about being a nursing major is that you get to be at the hospital or at a long-term care facility so far, because I'm only a second semester student, but you get to be working with patients and focus on the patient care. And I feel like it helps you really start to develop those key characteristics that a nurse has, because not only are we learning about it in school, but you get to practice it while you're on the floor.
I love our little cohorts. So we're with the same 40 people all 4 semesters. So you get really close with those people, and then you also learn a lot about patient care and how to take care of people, and I love that. So we're really close here, which I really like.
Just like making sure that I have enough time to study and make sure that I'm putting forth the amount of time that is necessary for study. And I would say that that's probably the most challenging part of it.
Probably the long clinical shifts, because we have 12-hour clinical shifts and then we have homework on top of that. So just managing our time is probably the hardest thing. I mean, there's hard days for sure. Like sometimes you have rough patients, sometimes it's just a lot of pressure on you, but I really do enjoy it and I'm happy with the career I picked. So I think if you like it, then your hard days aren't that bad, if that makes sense.
I want to be doing a job that's fulfilling and makes me happy, because I don't want to be in a job or stuck in a job that I'm regretting going to work every day. When I go to clinicals, I'm excited, even though it's at 5:30 in the morning, I'm excited. I get to help people.
This is Joseph Avila with Sun News signing off.